A provocative column we saw in the Wall Street Journal. It is about the drugs called statins. In fact, one of them, Lipitor, may be the most widely prescribed drug in the nation. But some people are claiming an unpublicized side effect from the medication: memory loss, difficulty concentrating, fuzzy thoughts. Today, 69-year-old Jane Brunsey loves volunteering for her granddaughter's middle school. But not long ago, her memory was so bad, while babysitting, she even lost track of her granddaughter.
I didn't want to talk on the phone because I couldn't think of what to say. I didn't know the words to answer people that asked me questions. I began to see the people I was talking to looking at each other kind of funny.
Her daughter Kristen was so concerned she explored getting Alzheimer's care for her mother and refused to let her babysit for her own grandchild.
It was devastating because she's just as important to Rachel as I am.
But Jane says it wasn't old age causing the memory problem. It was her cholesterol-lowering drug, or statin.
When I decided to stop taking Lipitor, within about 8 days, I would say, I was back to normal. I literally had to change doctors in order to do that.
Statins are used by millions of Americans in the hope of reducing the risk of a heart attack. And while they've saved thousands of lives, they have well-known side effects like muscle cramping. But is there a less publicized side effect? Memory loss. Dr. Beatrice Golomb runs the Statin Effect Study, where for the past 6 years, patients on statins have been able to report their own side effects to her website.
Of the first 1,000 or so reports that came to our office, 48% of them reported memory problems.
These side effects, can they mimic serious diseases like Alzheimer's?
They don't remember where they went earlier that day, what they had for breakfast.
Pfizer, the maker of Lipitor, tells ABC in a statement that the clinical trial data, quote, does not establish a causal link between Lipitor and memory loss.
10.
But for Jane Brunsey, who now controls her cholesterol through diet, the link was clear.
Good. I don't want to be the person in a nursing home with the lowest cholesterol. You know, I would rather have a high cholesterol and have a life.
And now on call, Dr. Timothy Johnson, who is ABC News medical editor. Tim, what about this? Thousands of people reporting anecdotally everywhere that they have word and memory loss on Lipitor. What does this say to you?
Well, I think we have to take these complaints seriously. I want to put it in perspective by pointing out that the company that makes Lipitor, one of the statins, has about 145 million years of patient experience in over 400 studies. They say that about 2% of people will report some kind of memory loss. The study that you quoted in the piece, that's a self-selected sample. In other words, these are only people who think they have a problem and therefore report it in. So that doesn't really tell us much, except for those people's experience. But I think when a patient complains of this, we ought to absolutely take it seriously. And if they really need a statin, if they can benefit from a statin, we ought to lower the dose or switch to another statin, which in many cases will take care of the problem.
But 2% could still be a lot of people, right?
It could be a lot of people. We have no idea what the status of those people is. These are just reports that come in over the transom, so to speak. But again, my attitude is if a patient is complaining about it, you take it seriously, you go over it with them, you see if there are other reasons causing it. If they really need the statin, if they've already had a heart attack or stroke, or they are at high risk for heart attacks and strokes and can really benefit from the drug, try another statin. I know personally some people who have done that, and it's worked just fine for them. Worst case scenario, you stop the statin and use other means to lower cholesterol.
Well, my question is it just Lipitor or is it all statins? And what could conceivably be the reason a statin was affecting the brain?
Well, the statins, of course, lower cholesterol, and our brain is full of cholesterol in the linings of our nerves. And so it's theoretically possible that if we change cholesterol levels, it might affect brain tissue. We don't have hard proof of that, but it certainly is theoretically possible. And as to the Lipitor, we get most reports on that drug because it's the #1 seller, but we have heard reports with other statins also.
And we've heard that by and large, these are women who are reporting it more than men. Is that a coincidence of some kind? What do you think that would be?
It could be. It also could, and I'm using a lot of coulds here because we don't know for sure, it could relate to the changing hormonal milieu of a woman as she enters into menopause. We certainly have heard these reports from men too. So it doesn't appear to be specifically tied to gender. But again, I want to emphasize, if a person has this problem, talk to your doctor, see about lowering the dose or switching to another statin before you give up on the drug, because if you really need it, the benefits will outweigh the risks.
There is a vitamin niacin, right, that has some cholesterol-lowering properties, but is it as good as a statin if you need to switch off statins altogether?
It isn't as good, but it does work, and the problem with it is it usually causes side effects such as facial flushing. There are some new versions of niacin coming out that appear to be better in terms of that side effect. So that's one alternative among several for people who have to go off the statins.
All right, Tim, always good to hear from you. Get perspective on this. And if you're having any problems out there, want to ask about Lipitor, visit abcnews.com. And our special on-call section is on heart disease. You can find it in the health section of abcnews.com.
In a flash, be the first to know what's coming up on Good Morning America tomorrow with the GMA Daily Flash email. All the great insider details you want to know from GMA. Go to abcnews.com, click the GMA page, and sign up for the Daily Flash. And you can even enter to win the weekly GMA Flash gift bag giveaway. Sign up now.